amount that I'll share and what that guidance. There's some guidance that came out. I think it was on Friday. What that guidance meant. Um, the return ready virtual event that is going to be put on by Region 3 Office of Head Start. And then we'll look at a couple of resources, and then I'll open it up for everybody to ask questions or um, whatever it is. All right, so let's first take a look at the cases in our region. They have said that our region is a hot spot and the cases continue to rise. All right, we are currently up to 10,634 cases in the Washington, D.C. region. There are 3,659 cases in D.C. with 28 deaths, 5,531 in Maryland with 124 deaths, and 1,444 in Virginia with 75 deaths. And they, at the moment, they said that we haven't reached our peak and that it'll, be sometime in the coming weeks. I'm not sure if they're given an actual projected date of when that might be, but it looks like it'll be weeks before we reach that peak. So, I think we should be prepared for to continue to stay at home. Schools, I think it was April 27th was the date that they set for kids to go back to school. Looking at the numbers and what the projected numbers might be and how long it's going to be before we hit a peak. I'm just not sure about that. I guess we'll see. Governor Hogan's done a great job of keeping us updated every day on what's happening in the state. They are turning the Baltimore Convention Center into a field hospital. I think there's going to have 250 beds where they'll be able to bring in patients who are recovering and about ready to leave the hospital, so they can go there and have a few more weeks of recovery before they, or I don't want to say weeks, but more time of recovery before they leave on out. Okay. Emil said, Governor Hogan, we should see our peak within the next 10 days, but that is likely to change. Okay, thanks, Emil. All right. So there we go, within the next 10 days. So I guess, we'll watch it and see what happens from there. And I guess everything's going to depend on that. So as we continue to do our social distancing and take precautionary measures, keep washing our hands, wear face masks, use hand sanitizer, it's going to help. It's going to help. But going along with what I just said about the Baltimore Convention Center, I think they're looking at other places across the state where they'll be able to construct other field hospitals. And, so we'll just wait and see what other updates come down the pike. They have looked at certain counties in the region and name them hot spots within the region. I don't have those handy with me, but I will make sure that I will send it out. So it looks like people are having to call in to get sound. So if anyone doesn't have sound, please call in. Yeah, please call in. I'm not sure why it's not working through audio, so call in to get the sound, please. Thank you. And I'll work to see exactly. I don't know if it's something that I'm doing or what, but I'll try to get that fixed. Try to get it fixed. All right. Let's talk about some updates from the previous meeting. We had some questions around enrollment. And I was actually just speaking with Donna from Southern Maryland Tri-County Community Action about enrollment. I posed the question to our questions and feedback to Region 3 OHS. And, they took our questions, they took our feedback, and they brought it to the National Office of Head Start. And not just ours, but other programs from across the nation have been having the same exact questions. And they are coming out with guidance. I'm not exactly sure when. Hopefully it'll be sometime this week. And, they'll come out with guidance on enrollment. I'm assuming enrollment for the summer. Well, I think they kind of addressed that during the webinar the other day, but enrollments for next program year. And, all the questions we had around how to do enrollment from a distance and collecting paperwork and getting signatures and those type of things. So we'll be looking forward to that coming out hopefully this week. Now, there was another question about attendance for summer programming and if they're going to be strict on upholding the 85% requirement. They didn't address it specifically during the webinar. And I do have the webinar. There's a link to the webinar. I sent it out. I believe I sent it out on Friday. And I can resend that link so that you can watch the entire webinar. You can go back to it anytime you want with the link. It's uploaded on YouTube. But they're going to be very, very relaxed with the requirements and the monitoring on the summer program funding. All right, so this really is a chance for programs to be able to be creative because they're going to be very flexible. All right, now, to be honest with you, I'd still take it with a grain of salt, right, and make sure that you keep everything documented and talk to your program specialist as much as possible. And anything that your program specialist says, make sure that you document it. And if you can get it in writing, get it in writing, because then that's going to, cover you, of course. Okay. But they did say that they're going to be very flexible with the monitoring, but you still got to cover yourself. Then we had a question about early Head Start and about transitioning to Head Start to regular Head Start programs. If those slots are going to be filled in Head Start, then you keep the kids in early Head Start until position slot opens up, or what to do from there. The only thing I got back from that was, what is your current grantee's current standard? So, I would go back and look at what your grantee's current standard is, and then, go from there. And we can talk. If you have this issue, we can talk separately or contact your program specialist. All right. But we should look forward to this enrollment guidance coming out very soon. And then, of course, go back and check out that webinar. I'll resend the link as soon as we're off of this call. The intent to apply, that whole webinar is about the summer, not the entire webinar, but it's about summer program funding, right? And the intent to apply is currently available. If you were not able to attend the webinar, it's currently available in HSES. Okay, and it's the deadline is April 13th, so that is 5 days from today. That's Monday. Okay, so if you haven't done the intent to apply, I would encourage you to do it as quickly as possible. Get in and do it as quickly as possible so that you can make sure that you have yourself covered. Whether or not you feel that you're going to be able to have a program, or if you feel that you're going to be ready, just do it. Do the intent to apply. This is going to make sure that you're eligible to apply. If you do not do the intent to apply, you will not be eligible to apply when the actual application comes out. All right, so make sure you do that intent to apply. Then when the application comes out, you'll be able to apply. The webinar goes through certain who's eligible to apply, and they do have a few specific guidelines and requirements, which I'm sure is going to come out with the application. All right, but if you want to learn, you want to get it in a little bit more detail, make sure you go check out that webinar if you have not checked it out already. They plan on beginning to distribute funds in May. So this is going to be a very quick turnaround. So just make sure you're on top of it, getting it done. Non-federal match. Last Friday, some guidance came out. Hopefully it came out to everyone. If not, I will send it to you. It was published last week discussing a blanket waiver for the non-federal match. And there were some questions, if this was a blanket waiver for the time missed, for the coronavirus outbreak, or if it was for the, the COLA and the QI and the funding from CARES for summer programs. So that guidance that came out was specifically for the COLA, it was for the QI, and for the money coming up for the summer. It was specifically for that. Basically, it says that it's a blanket waiver, and when you fill out your SF 424 to receive these funds, you put 0 for non-federal match, and it'll be covered. That guidance did not address if you need a waiver for the time missed during the coronavirus outbreak. If you do need a waiver for this time missed, they want you to contact your program specialist so you can do a revision. And they want you to do that as soon as possible because it seems at the moment that they are, as long as you contact your program specialist, you do submit for a revision, you'll get the waiver. So you're going to want to do that as soon as possible so you can get that out the way. You don't have to worry about it. All right. So if you need a revision for this time that's been off and you haven't been able to collect non-federal share, contact your program specialist so you can do a revision. All right. And the webinar explains that as well. So you'll be able to get that information in. Return Ready virtual events. Okay, so the Region 3, Office of Head Start Region 3 is currently planning an event. It's going to be called Return Ready, and it's going to be entirely virtual. Going in, the plan is for it to take place in the summer. All right, and this is what it is. They want to support child learning. They want to support Head Start, rising kindergarten children's school readiness, and sense of continuity of care learning after significant disruptions due to the extended break. They want to support child and family transitions through supportive, innovative school readiness activities for children and families, and responsive to impacts of disruption of services. They want to support grantee and partner school readiness transition teams at the Office of Head Start through the regional offices. They work with the HSSCOs and the state teams to support Head Start programs, school districts, partners, and stakeholders in supporting children and families to be ready to return and ready for school. Acknowledging and planning early for a specific response to school readiness transitions in 2020. So what they want to do is they are encouraging programs. They're encouraging programs to participate and kind of review your school readiness plan and add some strategies to return to school, to transition to school after this extended break. Now, they say that it's not mandatory, but it is encouraged. So they want you to look at your school readiness plan after attending this event, and you can start looking at it now. I would encourage you to start looking at it now if you're going to do this. And revise your school readiness plan implement a team that's going to work with your public school system to work on these transitions. All right. So you can see the fourth one is develop return ready to school revised school readiness plan 2020. Occurs to support Head Start grantees in identifying new challenges and to develop a revised school readiness transition plan for 2020 that anticipates an extended and unplanned break between Head Start ending and school beginning. This plan should be inclusive of Head Start families, local school districts, LEA stakeholders, and partners. All right. So they're currently working on this, the planning of this event. They're planning it in April. They're going to finalize it in May, and then possibly have it ready in June. They're trying to figure out all the logistics, and how we can do this virtually and still make it as effective as being there in person. And I'll be part of the team. Tressa, I think, will be part of the team. Other associations will be part of the team. I'm not exactly sure about TNTA because their contract is actually, I don't know if it's up yet, but it's up for bid. Every 5 years it goes up for bid. So there are other people who applied for that contract. So we'll see what happens with the TNTA system. They'll be there. We don't know if it'll be this ICF or if it'll be another TNTA system. I don't know what's happening at the moment with everything that's going on. So, but that is something to look forward to and get ready for, because that is coming down the pike within the next couple of months. And then the last thing that I wanted to get to before we open it up, just a couple of resources. The first one is called Wide Open Schools, and I'll make sure I send you the link. And I'm going to show you what Wide Open Schools, I'm going to show you their website. Let me get to the website. All right, so this is the website for Wide Open Schools, and it's created by a group called Common Sense. And you see, so schools are open, but schools are closed, but minds are wide open. You can click in as an educator. You can click in as a family. So this is a great resource that you can send out for your families, to your families. And you can see that there are resources in here from Khan Academy, NHSA is part of it, Boys and Girls Club, Sesame Workshops, Scholastic. A lot of resources in here that, so that you can, to help you be able to provide activities to your families and to help families be able to provide activities for their children at home. And so I advise you to just take a look at it. Maybe there's something in there that can help you help your families. Right. And I'd also like to just encourage anyone to, I don't know who you would have to bring it to, whoever would have to bring it to. Take a look at the COVID-19 relief small business administration loans. They're available for child care providers. They're also available to nonprofit organizations, small nonprofit organizations with under 300 employees. All right, and this is a document that I will email to you. I'm sorry, fewer than 500 employees. All right, and small businesses with fewer than 500 employees. So this is something that you may be able to, if your program is having trouble with paying staff during this time, this may be able to help you out. Or if you are partnered with a child care program, this may help them out as well. This is some information that you can bring to them. One of the things about it that I'd like to point out, you see here in the questioning, the frequently asked questions, it says, how much can I borrow? It says, eligible entities are eligible to borrow 2.5 times their average monthly payroll, expenses, or up to $10 million, whichever amount is less. The amount is intended to help cover 8 weeks of payroll expenses, as well as mortgage, interest, rent, utilities, etc. The 8-week period may be applied to any time frame between February 15th and June 30th. And then it goes down and shows a list of what the loan can be used for. Now, when we talk about the loan being repaid, the question is, does the loan have to be repaid? And if so, how much? If you meet all of the requirements of this loan, it becomes a grant and is forgiven for the total of an 8-week period of payroll, rent, leases, utilities, and existing interest payments on mortgages. All right, part of the loan can also be used for other business-related expenses like supplies, but that portion of the loan will not be forgiven. All right, so it can become a grant for an 8-week period. I believe any amount of money you use that goes beyond 8 weeks would not be forgiven. Okay, so there's a lot of questions here, and I can send this to you so that you can look at it, and whoever makes those decisions within your program, you can give it to them, and maybe it's something that can help your program out if they are in need, or if there's a child care program that you work with that could use the support. All right. And then lastly, we are developing a page on our website to just provide resources, information for parents. So if you have any resources, if you have any ideas, any thoughts of what should be added to this page, please make sure that you send me an email so that we can get it up there. Hopefully, we'll have this page up by next week. That's the plan. All right. So other than that, I don't have anything else. If you have anything, please feel free to ask some questions, make some comments. I'd like to hear how things are going in your program at the moment. And I got it open for anyone who wants to ask a question or make a comment or give some feedback. Tressa, I don't know if you ever made it back. Do you have anything that you want to add in?
Oh, gosh.
Tressa?
Yeah. Oh. Am I there? Did I? Let's see.
Yep. I can hear you, Tressa. I think you're there. Okay. Well, I'm not sure if Tressa's going to make it back. If she has
Can you hear me now?
Yeah, I can hear you, Tressa. We can hear you.
Oh, okay. I'm
Okay,
having terrible technical difficulties.
No.
The National Head Start Association came out with a brief, I guess not a brief, it's 9 pages, but on Head Start Helps, about all the different things that Head Start is doing to help in their communities. Did you get that, Simeon, to send out to everybody?
Yes, I did. I got that.
Okay.
Yeah. Yeah.
So I thought that was a very well presented article, and also the e-click, the social emotional messages that you could send out to parents, I thought was a very good help. Together we have this, and just empowering messages like that, I thought were very good. That's all. Starting to work on the Head Start state supplemental funding, because we wanted to get that out by July 1st this year. Don't know how that's really going to happen, but that's the plan. So I'll get that out to everybody as soon as I finish doing it. And any questions, concerns?
Tressa, I didn't, that one thing from eClick that you just mentioned, I didn't see it or get it. Could you send that to me?
Sure.
Yeah.
I have to go back through my emails and get it. It was just social messages, and it was really cute. Like, together we've got this, and very empowering kind of messages. So I'll find that and send it to you, Simeon.
Okay, great. Mhm. All right. Are there any other updates or questions from anyone?
Simeon, can you hear me? It's Marisol from Head Start, MRDC.
Yeah. Hey, Marisol.
Hi, how you guys doing? I do have one question. I'm not sure if you or anyone on the line has any idea, but one of the things that I was trying to look into is as far as recruitment during this time, has anyone looked into or heard of any way to upload documents where it's safe and confidential?
There is something called, you mean upload it to like a server or something like that?
Yeah, because what I'm seeing is like to help for families to be able to upload copies of their pay stubs, child's birth certificate, or the medical card, something like that. I'm trying to figure that out, but I also want to make sure that it's a confidential way to do it. I don't want anybody's information to get lost out there. Someone get it.
Right. Yeah. I'm not sure if DocuSign allows you to upload documents. Do you know what DocuSign is? DocuSign is a secured software, and I'm not sure if it's connected to a website or what, but it allows people to sign electronically. So you create a form and they can sign electronically. I believe that you can attach documents to it, and then you get it through a safe portal. I'm not exactly sure. Now, I do know that Yvonne was telling me, she has a program where you can send a link and it is secured and people can upload documents to that link. That's something that we could definitely look into, and I'll get that information from Yvonne and I'll try to grab as many resources as I can and I'll send it out to everyone.
Oh, okay. Thank you.
Yeah. Tracy says in the chat, our Maryland Child Care Centers that are serving essential personnel have new guidelines for the number of children per room, 8 to 9, and environments, closed rooms, 4 walls, and door for each classroom. Do we know if these more restrictive guidelines continue once child care programs are able to reopen? Okay.
They should update that on the Division of Early Childhood website under that coronavirus ribbon that they have. So if you go into early childhood education for the state of Maryland, they should probably update that regularly.
Okay, so that'll be updated on the Division of Early Childhood's website.
Right. So yes, once you go to our website, which is earlychildhood.marylandpublicschools.org, they have a yellow banner with all the COVID-19 updates.
Right.
So
I think she's asking because she knows about the update. I think what she's asking is, are these more restrictive guidelines going to continue once child care programs reopen?
I wouldn't think so, but I don't know at what pace things are going to reopen. So this website's probably the best and most accurate way to learn about how that's going to roll out.
Okay.
I just don't foresee that we have everything closed and locked on Friday and everything reopens on Monday. I think there'll be a phase-in period. I'm just not sure. But I will put that question to the leadership and see if they have any ideas.
Yeah. Okay.
So will the guidelines be in effect after things are open? Okay.
Yeah. All right. And for Marisol, I'm not sure what data system you use, but Yvonne said for programs that use My Head Start, they're working on a way to have a secure portal so that you can upload. And Saru said that DocuShare does allow you to upload and send documents.
Thank you. I'll look into it. Thanks.
Okay, no problem. Any other questions, comments, or concerns? All right. Well, thank you for being on the call, and I will make sure this has been recorded, so I'll send it out for anyone who missed the recording. And as usual, throughout the week, I'll keep you updated with anything that's going on or anything that's happening. I'll keep the website updated, and I will be working on a web page for parents. So if you have any ideas or thoughts about what should be on that web page, please feel free to email me. All right?
And I have one request for anybody for any teachers that are working with children or have some little 3 to 4 minute videos. If you have something you'd like to share on our Maryland Families Engage Wednesday watch party, we're soliciting for little videos about activities children and families can do together, especially on social emotional topics. So if you go to the Maryland Families Engage website, there's a little flyer that says shorts, and it tells you where you can upload your little videos to. And we'd love to have them come in and be able to share them with folks.
Okay. All right. That sounds good.
Okay.
Well, all right. Thank you, Tressa. And everyone else that was here, thank you. And I'll let you get on with the rest of your day. And I'll be talking to you soon. Thank you.
Thank you very much.
Thank you.
Thank you.
Bye-bye.
Bye-bye.